Linda Wilkinson, the Gestational Diabetes Prevention Lead for the Humber and North Yorkshire ICS.
And I'm Stephanie Howden. I'm a consultant obstetrician and gynaecologist with an interest in diabetes in pregnancy, also working in the North Yorkshire and Humber region. So I think we're going to have a chat to you today, or have a chat amongst ourselves, about what diabetes in pregnancy involves and how it might affect you during your pregnancy and afterwards.
So Steph, which women would get screened for gestational diabetes?
So we know there are quite a few risk factors for gestational diabetes, and that one of the biggest ones of those is family history. So women who have a parent with diabetes, so type 2 diabetes or type 1 diabetes, would be screened. We know women with a higher body mass index are at higher risk. Also women with something called polycystic ovary syndrome. So they're probably the main group of ladies that get screened. Some ladies, because of their ethnicity, are at a higher risk, or some women who take medications such as antipsychotic medication need to be screened as well. But your midwife will let you know if you're at risk and if you're in that group, and you'll be offered a test to see if you have diabetes in pregnancy.
And what does the test involve?
So for most people, it involves a sugary drink that you take and have a blood test just before that, and then a blood test 2 hours later. But that can vary depending on where you live, so which hospital in particular, or at what stage in pregnancy you're at. If the first or second blood test come above a certain level, then that would mean that you have diabetes in pregnancy, and it's something then we can look into managing and keeping you and your baby as well as possible.
And is that the same for all women? What would happen sort of next as a general rule?
So once we have that diagnosis of diabetes in pregnancy, so we call that gestational diabetes, women are invited into the hospital, or they might have a phone call so that they can be given that information. They then see a multidisciplinary team who'll be looking after them through the course of the pregnancy. And that's so that we can focus on their maternity care, their general health, but also the diabetes. So there'll be an obstetrician who focuses on the care of baby and mum. There'll be a diabetic midwife or nurse, or a diabetic endocrinologist, so a diabetes doctor, and together they'll look after the care in pregnancy, they'll look after the care of the diabetes, and make plans for the best timing and the best place for baby to be born.
And will they get some advice on things they should be eating or things they should be avoiding?
Yeah, that's another important member of the team. So very often women will have access to a dietitian, because we know that certain foods, especially carbohydrates, can put blood sugars up. So it'll be a case of having a discussion about what the current diet is, and how that can be changed ever so slightly, or modifications made to help keep the blood sugars under control.
And will anything alter in the pregnancy? Will they need to be seen more frequently, or have any more scans or anything?
It depends on the pathway of care that the woman's on already. So some women might already be having regular scans for issues such as growth or other conditions in pregnancy. So for them, they probably wouldn't need to be seen that much more often. But for a woman who'd been under midwifery care, or who was more low risk to begin with, their care will be kind of stepped up a little bit. So most women will be having regular scans to check on baby's growth, and an opportunity to engage with the diabetic team, either virtually or face to face, to check those blood sugars. And depending on that whole picture together, they may be offered extra treatment. So that sometimes is in tablet form, sometimes it involves insulin injections as well. But it really depends how the pregnancy is affecting the diabetes.
And will it affect the delivery, their choices at delivery?
So for most women, gestational diabetes doesn't mean that they need to change their how baby's born. So most babies will still be born vaginally, but we usually recommend that babies are born by 40 weeks and 6 days. So that's a little bit different to if you don't have gestational diabetes. So some women will be offered induction of labour. We also know that gestational diabetes sometimes can make babies grow bigger, and especially if a lady's blood sugars aren't well controlled, that might be a reason for the baby to come a little bit sooner. So we might offer induction at a different time based on the whole picture of care at the end of pregnancy.
And if they needed more treatment other than diet and activity, would that need to carry on after they've had the baby? Or?
So for gestational diabetes, the good news is that then when baby's born, the placenta and baby that are causing the blood sugars not to be well controlled are not in the mum anymore. So the diabetes does go away, but it doesn't go away forever for all women. So we know there's a higher risk of these women then developing diabetes later on. So
yeah, what do they need to do after they've had the baby? Is there anything specific they should be doing?
Yeah, so the first thing they need to do is get their GP when they go for their postnatal visit to check that they're still not diabetic. So that involves a blood test to check the blood levels to see that that diabetes wasn't a pre-existing diabetes and it definitely was gestational diabetes. And if that's the case, that's really good. I still advise my ladies to carry on with the things that we've given them information on. They can have a little bit of a break because obviously having a new baby means that you're going to be very busy and it's not so easy to follow that diet and exercise. But keeping the diet and exercise in that pattern that they've learned does then mean that they're less likely to go on and develop diabetes in later life.
Are they generally more at risk of developing type 2 diabetes?
Yeah, it's a much higher risk compared to the general population because the body, when it was under stress, has shown that predisposition to diabetes. So it does mean that it's a really good idea for your GP to do a blood test every year. I say about the time of baby's birthday because it's an easy time to remember.
Oh yeah, it's a good time.
It's a good trigger to think about. Yeah.
And is there anything else available post delivery to help?
Yes, there is a diabetes prevention programme. I think you know a bit more about that than I do, so can you tell me a bit more about that?
So the National Diabetes Prevention Programme is available to lots of people that are at risk of diabetes, but particularly for women that have had gestational diabetes, providing that they don't actually have diabetes post-delivery, all the women are entitled to be referred to that programme. Depending which area they live, their midwife or consultant may be able to refer them or their diabetes team, but certainly their GP will be able to refer them for that, and hopefully that'll help them decrease their risk of type 2 diabetes in the future.
So from your time working with pregnant ladies with diabetes, do you have any tips and tricks for our women to help them get through this part of pregnancy?
I think using all the information that's out there and all the information that the specialist team give them, you know, they're either at the end of a phone or the end of an app or emails, depending on how you know, each team communicate generally every week. So they're always willing to, you know, go through things and talk about, you know, healthy snacks and things generally to try and help, you know, women keep going and keep their you know, glucose levels under control.
I think that's a big thing, isn't it? Healthy snacks.
Yes.
Because in hospitals where we should be the best places to have healthy snacks, but often we're not, and we have vending machines and things like that. So if you have hospital appointments, sometimes it's a good idea to put a healthy snack in your bag and have that available, because otherwise you might end up finding that you're stuck for something to eat.
Yeah, and I think unfortunately a lot of things at the hospital are quite costly, aren't they, as well? So you know, if you're on a budget, it's not easy if you're having to buy meals, is it, at the hospital? No. So having something with you just keeps you going while you're waiting in a busy clinic, doesn't it?
And probably something else that people are worried about is how their babies are going to be because of their diabetes. So I know lots of women worry about themselves and about the lifestyles that they need to lead during pregnancy, but I think most mums' main worry is their babies, isn't it?
Yes, I think so, and we do know that you know, children of mums that have had gestational diabetes are about 6 times more likely to develop diabetes themselves sometime in their life. So, you know, trying to maintain, as Steph said, that you know, all the progress that they've you know, done through pregnancy and all the healthy eating, you know, if that can be maintained, then that's not only helping them and reducing their risk, it's also helping the rest of the family as well.
But the good news in pregnancy is that when gestational diabetes is well managed, it probably won't have any effect on your baby. So some babies are a bit bigger, but on the whole, babies who are born to mums who have gestational diabetes do very well. So that's something really important to consider. And the better you can keep your sugar control, particularly around the time of birth, that stops baby then producing too much of their own insulin, that stops their blood sugars dropping, and it keeps baby well in that immediate time just after birth. So that's something to focus on in that last bit, just when you're coming up to the finishing line.
So just thinking of that, will it affect how long mum has to stay in hospital?
Yeah, so babies who are born to mums with gestational diabetes do need some extra monitoring, because baby themselves aren't diabetic. When they're exposed to higher sugar levels, they make some more insulin in the body, and when they're born, that higher insulin level means that they can drop their blood sugars. That can make them a bit cold, it can make them not feed quite so well, and that sometimes can affect their breathing, so they need to be monitored just a little bit more closely. And something we'll probably discuss with you is giving baby a little bit of your own breast milk, and having that ready just before baby's born. So even if you have other plans for feeding, obviously we'll always recommend breastfeeding, but a little bit of your own breast milk that's collected before baby's born can help keep those blood sugars up, and that might end up shortening your stay in hospital. So
that's worth knowing, isn't it?
Yeah.
So if there is anything else, you know, your teams are always there to help and advise you, so, you know, never hesitate, give them a call.
Yeah, and it is a condition that is really generally well managed. Sometimes it's not always possible to manage with diet and exercise, and women struggle with that sometimes, but the medication's there, the team is there to give you and your baby the best care, so hopefully everything goes well for you.
Well, thank you for listening.
Thanks.